Hi, and welcome to another video update from the Fire Brigade Union. Once again, unique circumstances caused by the COVID-19 lockdown. This time we're joined by two groups of people. First of all, General Secretary Matt Wrack, and also the Black Watch from Cambridge Fire Station, who've got some questions for the General Secretary. So welcome to everyone. Thanks for coming on board.
Hi, Sam.
I think the first question is from Dom, and this is a question about firefighters who are off with COVID-19 systems. Dom.
Yeah, hi Tam, hi Matt. So my question is, how many firefighters are actually off with COVID-19 symptoms at the minute, nationally?
Hi, Don. Hi, everyone. Okay, well, we're trying to gather all this information every week regularly. The latest report we put out nationally was that there was some 3,000 firefighters across the UK off, either with testing positive but in very small numbers, or self-isolating because of symptoms or because of somebody in their household. I think that has possibly dropped in the past week or so. So there are ups and downs in this. I think we know that the centre of the crisis currently has been in London and the West Midlands to a lesser degree. And London certainly had the highest levels of absence. So it's certainly having an impact. It's varying between about 10 or 12% of the workforce down to about 4 or 5%. So it varies across services across the country.
Thanks, Matt. I think we've also got another question from a member of the Watch, Rick, and this is a question about the National Tripartite Agreement. Over to you, Rick.
Hello, Matt.
Hi, Rick.
Yeah, my question is regarding additional duties and additional work that we are taking on as firefighters, which is good and important. But in real terms, we're around sort of £4,000 pay cut. So what will happen in the future with regards to this, please?
Yeah, absolutely crucial points there. I suppose the first question for us is about, and I think we need feedback from yourselves as well, is that we had a debate about the additional roles. We were aware that some people are lots of people are rightly very angry about how we've been treated over the past decade and our pay has fallen. Suddenly this crisis comes along. But at the same time, lots of people wanted to do what they could to help our communities in the midst of the COVID-19 crisis. So we had a difficult balancing act to play there. And we decided to engage with this tripartite discussion. So that's with the fire service employers and the National Fire Chiefs Council. And I think the strength of that is it's given us a good basis for a trade union agreement. So I think people who want to volunteer to do those activities can be confident there's a good framework behind it. It addresses safety, training, PPE, and so on. All things that are actually now hitting the media because of the weaknesses on PPE, for example, in the health service. So we've put that in place. But we have never forgotten, and we've made this point in those discussions, that actually we've had a pay freeze effectively for a decade, as the rest of the public sector have. Interesting, we've got a meeting with the NJC Joint Secretaries next week, and we will be asking them what their thoughts are in terms of pay. I was at a TUC meeting, or virtual meeting, earlier this week, where again I asked the same point as to what's happening on pay in other parts of the public sector. What's the response of employers? We're hearing a lot of praise from government, including from the Prime Minister and others, about what the health service, what other public sector workers, including ourselves, are doing in this crisis. And it'll be absolutely disgraceful if at the end of that they turn around and say, well, you're all back on for another 1% or 2% pay rise. We don't know the outcome of that yet, but clearly I expect the expectations of public sector workers, including firefighters, will be that something needs to be done about this now.
Yeah, sure. So do you think that will benefit our pay going forward, our pay dispute?
Well, that's the big question, isn't it? That we're all getting praised by the government and politicians and the media currently because of the crisis. And you hope that that'll mean a change of direction. I have to say the cynical part of me says that actually once it's over, they'll go back to praising us but not paying us. There's talk about a medal for NHS workers and so on. I think people want PPE and pay and safety rather than medals. But we'll see. But we will have to. We have to go after this and make our case to the country that actually the workers who've seen the country through this crisis are the very workers who are the most exploited in some cases, low-paid shop workers, delivery workers, and so on. And then those of us working in public services who've had our pensions attacked, our pay frozen, and tens of thousands, indeed hundreds of thousands of jobs cut across the public services over the past decade. That's a big challenge, and we will not be letting it drop. I think we have to get ready for the end of this to start our political campaigning to ensure that there's investment in public services, including pay.
Thank you.
Now, Tom, I believe you've got a question around BA testing fluid, which I have to say is coming up right across the country.
Hi, Tam. Hi, Matt. It's just, we've heard a rumour that there's a lack of cleaning fluid for BA sets and BA masks in particular. Can you shed any light on this? Is that what you're getting feedback from the rest of the country?
Yeah, we picked this up that in some fire services, and it would be interesting what's happening in Cambridgeshire, whether it is a problem there. We've heard of reports of the management downgrading BA handover tests, BA acceptance tests, and that one of the reasons given has been an emerging shortage or an actual shortage of cleaning fluid for the BA sets. And that's set alarm bells ringing, because obviously the acceptance test is a key safety test for a crucial bit of life-saving equipment, and we shouldn't be downgrading the safety acceptance tests for that bit of key equipment. Other services have not done that, so it's not across the board. And I think the answer to us is, actually, if we need cleaning fluid, we should demand that we get the adequate cleaning fluid to make sure we keep ourselves safe. So we are taking it up, we are challenging that. We're going to be issuing a circular on that in the next day or so, advising people to challenge their service management if that is what's been introduced, and to monitor it carefully, and then to look at longer term solutions of how we deal with that issue for the future. But it shouldn't be happening, in my view.
Absolutely not. Now, Dom, you've got a question about testing.
Yeah, obviously it's probably well over a week now since the government announced that firefighters would be part of the first people to get tested for COVID-19. When are we likely to see this at a ground level? And could you tell me what type of tests we will be having?
Okay, so the testing is the testing that just checks whether the virus is present currently. So it's not, it identifies people who are currently have the virus. I think it's called antigen testing. And then obviously we know there's research going on to develop wider tests as to whether people have had the virus in the past, but that's not currently widely available. And in terms of testing of firefighters and others, I think testing is, again, one of the huge public debates about the level of testing. We know the government has pledged to get 100,000 tests a day delivered by the end of the month. And currently it doesn't look as though that is going to be achieved. I hope it is, because testing should be a central part of the strategy. I think if you first of all, to deal with the virus generally, it seems to us that a logical approach is to test as many people as possible to trace back where the virus has spread to. But I think for workers who are asked to carry on working, it's also central there, because if you've got a key worker strategy, and key workers are the NHS, ourselves, local government, some people in education, but also those working in shops or delivery services and so on, then if you are asking people to go into work, so effectively your employer is saying to you, you need to carry on coming to work, which is clearly putting you at additional risk in reality. And therefore testing should be part of that strategy, because it means that you would be able to identify firefighters who did have the virus, or people who were self-isolating but didn't have the virus could return to work. And that protects the workforce. It also protects people we're engaging with in the community. We're going out on calls. So it's absolutely essential. We know there are some firefighters who've been tested. I think the first ones seem to have been tested in Northern Ireland, then Scotland, and there's some in Wales. I've not heard reports yet that we've had many done in England as yet. Hopefully that will start to be rolled out. And again, that's something I think our union reps at brigade level need to be asking of brigade management as when is the testing going to be coming to Cambridgeshire, for example, in your own case?
Thanks, Matt. Now, Cameron, I believe you've got a question regarding what happens if a service tries to introduce change locally. So, Cameron?
Yeah, I mean, there's obviously a lot of work is going on at the moment, and I mean, I think it's fantastic that we have the National Tripartite Agreement, a really, really important agreement. But just kind of as a more wider question, given the dynamics that are at play at the moment, like if a fire and rescue service does try to introduce change locally that's not in line with the Tripartite Agreement, then what should people do? What should members do? And what's the national view on that?
Yeah, that's an important point, Cameron. And I think one thing that people are aware of, in a crisis, some people try and take advantage of that crisis. And so employers might take advantage of a situation to push through changes that they wouldn't have got away with in normal time. So I think we have to be very alive to that. So our answer to that is firstly to make sure the union carries on functioning, as you know. So we need our union officials at branch, brigade and regional level to carry on functioning to represent and organise members, so that we demand that employers negotiate with us if they want any changes, whether that's the additional work under the tripartite agreement or any changes to how we work, say shift patterns or overtime and so on. They come to us and discuss it with us as a union. They don't simply unilaterally impose it. I think in terms of additional roles, we would advise people that if it's within the tripartite agreement, then that's fine. We've got no problem with it. If it's outside of that, then there's a mechanism for every service to raise that through their representatives on the National Fire Chiefs Council, or employers to do the same, or also the union to do the same. And equally, if there's changes to conditions of service, don't accept it without negotiation. Don't allow any employer to impose change on us at local level. We demand the right to consultation, we demand a right to negotiation. These are our contracts of employment at the end of the day, and we've got to protect them even in the face of the COVID-19 crisis.
Thanks.
Matt, thanks. Well, that's all we've got time for, I'm afraid, on this occasion. But this is the first in a new series for the video update. So if your watch or your station or workplace or even your section wants to take part, please just email us at the address that's on the screen now. For more generic information, of course, you can go to our website, and that's simply www.fbu.org.uk.
Is that a shout?
We've got a shout. See you later.
A shout.
Timing's brilliant.
Thanks, Matt.
Wow, Tam,
we
got a shout. What? Perfect timing in terms of getting the questions in.